Hello, my dear friends and my dear future nursing officers. Welcome you all to the my YouTube channel, Nursing Concepts by Raghav. So, because of some personal problems, I was not able to make a videos from I think from last 10 days. Uh, Today, I'm back again. We will discuss in this today's video session one of the very important and frequently asked a drug. Okay, most commonly and most frequently asked a drug in the all the competitive exams, not only in the NORCET, so even for the state and the other central government exams. So this drug was considered to be the very important and most common and frequently asked drug. So regarding that drug we will discuss today. So hope you all might guess the name to the thumbnail. Today's discussion is on the drug digoxin. Okay, so without wasting much time, let's begin with the today's topic. So suppose if you are watching for the first time, please do subscribe and don't forget to press on the bell icon so that you will receive my next video notification. And please watch till the end so that you will never miss any point, will not miss any point related to the today's topic. तो चलिए शुरू करते हैं आज के टॉपिक, आज के ड्रग इन्फॉर्मेशन या ड्रग के डिस्कशन में डिगॉक्सिन. ओके, तो डिगॉक्सिन, तो पहले देखते हैं ये ड्रग क्या है. Okay, in this video I'm going to discuss what actually this drug is, how it is going to act. Okay, that is what the mode of action or the mechanism of action we call. Then what are the indications for this drug, what are the contraindications for this drug, what are the side effects of the drug, what will happen if there is a toxicity or the overdoses of the drug. Okay, and what is our role, what is the nurse's role, priority role, and how to manage the toxicity, and that all things we will discuss in the today's discussion. तो चलिए देखते हैं डिगॉक्सिन. तो पहले देखते हैं डिगॉक्सिन क्या है. तो डिगॉक्सिन और to which family or the to which group this drug belongs. See, this drug belongs to an cardiac glycoside. So this drug belongs to cardiac glycoside. So this is a drug which belongs to the group of cardiac glycosides, which has been derived from the and plant source. Okay, so it is derived from a plant called as a digitalis purpurae. Okay, so this is a drug from which this digitalis component, or we can say it is the chemical compound which has been taken from this this plant source. Okay, this is a plant digitalis purpurae. Then this is a drug of choice for this is a drug of choice for heart failure. This is drug of choice for heart failure. So this is very important. Many times it has been asked in the exam, which is the drug of choice for the heart failure. Okay, so this is the drug of choice. So this is all about the introduction of digoxin. Let us discuss how this acts. What is the mode of action, or we call it as a mechanism of action. One we call it as mechanism of action. So what is the primary mechanism of action? See, this drug inhibits, so the major mechanism of action is this inhibits the sodium potassium pump ATPase. So it will inhibit the sodium and potassium potassium ATPase. So this is an exchange of the ion takes place between the intracellular and the extracellular. So during this pump, what happens usually? So the sodium gets outside and the potassium gets inside. So but in this condition it will get inhibited. So what happens here? So the sodium gets influxed, and even the calcium and the sodium gets influxed, and potassium gets outside. So this is what the actual function of this cardiac glycoside, that is a digoxin. And thereby this is specially this process which will be inhibited especially in the cardiac muscle cells. Cardiac muscle cells. So this has been inhibited in the cardiac muscle cells, and thereby increases the sodium level. So it increases the calcium level in the muscle cells and causes the muscle fibers to contract. Muscle fibers to contract. So what happens because of the inhibition of this exchange of the ions, the calcium get influxed into the cell and causes the contraction of the muscle. So especially this will take place in the cardiac muscle. So it is a cardiac glycoside. So because of this muscle contraction, as I'm particularly talking about the cardiac muscle, see, because of the cardiac muscle contraction, the heart can pump effectively the blood into the aorta and even the pulmonary artery. So this is means it majorly helps for the contraction of the cardiac muscle, or we can say the ventricular contraction will be enhanced by the this drug. So this is we call it as a positive. So this effect we call it as a positive inotropic effect. This is called as positive inotropic effect. So this is many times it has been asked in the exam. So what is the effect of the digoxin on the cardiac muscle? So there you remember it acts as a positive inotropic effect. So that means it will enhances the contraction of the cardiac muscle and thereby increases the cardiac output. So that is the mechanism of action of this cardiac glycoside. And the second, another important function or the mechanism of action of this drug is second one, it acts as a negative chromo chromotrophic effect. It acts as a negative chromotrophic chronotrophic effect. So what does it mean? So it means it will reduces the transmission of impulses from the AV nodes. Okay, means the speed of the conduction through the AV nodes. So as you all know, the conduction system of the heart. So from the SA node, then to the AV node, then to the Purkinje, that is a bundle of his, then Purkinje fibers. So this is how the impulses are being generated and being transmitted in the heart. So but here it will decreases the conductivity from the AV node and thereby causes or decreases the heart rate. So that is what the second effect of our second mechanism, that is called as a negative chronotrophic effect. So this will what it does, it will decreases the speed of conduction through AV node. It will decreases the conduction through the AV node and thereby decreases the heart rate. So that means whenever the patient is on the digoxin therapy or the patient is being treated with the digoxin, the heart rate always comes down. So this is the effect also, and we can say this is an adverse effect also of the drug. So it will goes to or it will leads to the bradycardia in the patient in the case of toxicity or in the case of overdosage. So these are the very important mechanism of action. You must remember this. One is a positive inotropic. In the similarly, it acts as a negative chronotropic effect on the heart. Reduces the heart rate. In the similarly, it will increases the cardiac contractility or the ventricular contractility and thereby increases the cardiac output. So it will increases the cardiac output. So these are the mechanism of action. So now let us discuss what are the indications when or in which cases we do use this uh, digoxin drug. So as I told, it is a choice of drug in the heart failure. So where we use this drug as a choice, especially in the case of where the EF is very low, ejection fraction is very low, we do use this digoxin in the case of heart failure, especially with the EF level is very low. And second thing, it is being used in the atrial flutter and the atrial fibrillation. See, here this is actually atrial arrhythmias. So as I discussed in the mechanism of action, it will decreases the heart rate because it will decreases the speed of conduction through the AV node, and thereby decreases the heart rate. See, whenever there is an atrial flutter or the atrial fibrillation, you can see the heart rate which is going more than like 200, 180 or 200, 250. Okay, even it will go up to in the atrial fibrillation, even it may go up to the 350 as well. In such cases we can use this a drug as an to reduce the heart rate. Okay, so this is actually the adverse effect, but here in this case it acts as an it will be used as a for the effect. So atrial flutter and the atrial fibrillations are the indication for digoxin therapy. So these are the very two important, you must remember this indication very importantly. Remember this many times, the exam in the exam we got this question. So next we'll see what happens when there is an excessive or over toxicity or the overdoses of the drug. See, whenever the patient is on the digoxin, we have to monitor the serum digoxin level. So this is very important because the toxicity can lead to so many complications, or even the patient may go for the like arrest as well. So the bradycardia again, later it can causes the arrest. See, the what is the therapeutic level, then what is the normal serum digoxin level to be a monitor. The normal digoxin level should be between the 0.5 to 2 point or the 2 nanogram per a deciliter. This is called as a therapeutic level of the digoxin in the blood or in the serum. So if this goes more than 2, when do you call it as a toxicity? So this, if it goes more than 2 nanograms per deciliter, then we call it as a toxicity. Okay, if it goes more than 2, then it is called as uh, then it is called as a toxicity or the digoxin toxicity. So what are the clinical features we will see in the case of toxicity? So the initial symptoms will be the nausea and the vomiting. See, this will triggers the actually this drug will triggers the CTZ, that is chemoreceptor trigger zone will be stimulated by the digoxin and thereby causes nausea and the vomiting in the patient. So this is considered to be the earlier symptom of toxicity. So if the patient complains of nausea, vomiting and all, if the patient is on the digoxin, then suspect for the toxicity. These are the earlier symptoms. So later the patient will have a bradycardia. As I told, it will reduce the heart rate. The patient will go for the bradycardia. So bradycardia, then patient later it will patient may develop the arrhythmias, then confusion, weakness, and very important is the xanthopia. The xanthopia, where the patient will have a yellow or the green vision. So you will develop a yellowish or the greenish vision in the, that means there is a vision abnormality can be seen in this patient, and it will causes the hypokalemia. As this drug, as I explained in the mechanism of action, it will causes the calcium to go out of the cell, uh, leading to the hypokalemia. So the hypokalemia condition increases the toxicity of the drug. So this is very important, you must remember this. So this is a major adverse effect of the toxicity in the, or the we can say uh, hypokalemia increases the risk of toxicity. So this will increases the risk of toxicity. If the patient is hypokalemic, then definitely the patient will have or it will increase the toxicity of the digoxin. So these are the some important signs you must remember. Bradycardia, okay, bradycardia. Earlier signs were the vomiting, nausea, the bradycardia, arrhythmia, confusions, and all the later signs. Then coming to the treatment. So how to manage the toxicity in case. So as I told, if the levels where goes more than the 2 nanogram, then it is called as digoxin toxicity. The first priority action should be we should stop the drug, stop the drug, or we can say withhold the next dose, withhold the next dose. So this is the will be the first priority in the case of digoxin toxicity. You may get a question like, so what is the priority nursing action or the priority action to be taken if you found a patient with the signs or the bradycardia in the patient with the digoxin therapy? So then the first action will be always skip the next dose or withhold the next dose or stop the drug immediately and inform the healthcare worker or the doctor. And the next thing is we should correct the electrolyte. So during the toxicity there is an hypokalemia as I told, then hypomagnesemia can also be there. So we have to correct these two, especially the potassium hypokalemia will be there. So we should always treat this or correct this electrolyte imbalance in the case of toxicity. Then we can use the specific antidote, that is dizibind or dizifab. So these are called as a antidotes for the, these are called as antidotes, antidotes for the digoxin. Very important, remember these two drug. Many times it has been asked in the exam, what is the specific antidote for the digoxin toxicity? Dizibind. So the name in the word itself, it has a digoxin, okay. Bind, it means it will bind to the digoxin and thereby prevents the absorption. So that is what the dizibind does. So this is about the toxicity. Then coming to the nursing responsibilities, what is our role? So first thing is, as I told, so this is related to the cardiac drug, to understand and the patient, as I told, it will leads to the bradycardia in the patient. So always remember, we should always check the apical pulse rate for 1 full minute. So apical pulse rate should be checked for 1 full minute. Okay, 1 full minute apical pulse, not the radial and all. So we should always check the apical pulse, very important. Then next is, as I told, in the case of toxicity, if you find any signs of related to the toxicity, then stop the drug or withhold the next dose. The patient has already taken it, okay. If we have to stop or withhold the next dosage in the case of toxicity or signs suggestive of the toxicity. So this is the first priority, remember, very important. Okay, then next is monitoring the electrolyte imbalances. As I told, it will causes the hypokalemia and the hypomagnesemia. So we have to look, watch the patient for the electrolyte imbalance signs like hypokalemia and all. So we have to check for the patient's signs related to these electrolyte imbalances. And hypokalemia is a major risk for the digoxin toxicity. So the patient should be always supplied with the potassium rich diet, especially if the patient is on the digoxin therapy. So these are the important aspects we should remember. And one more thing I have forgotten here, that is contraindications. We have seen the indications. So what are the contraindications for this drug? So the first contraindication will be the bradycardia. So in the case of bradycardia, if the patient's heart rate goes less than the 60 beats per minute, then we have to stop this, or this is not an indication, okay, where we have to stop the drug. And in the case of VT and the VF, ventricular tachycardia and the ventricular fibrillation, we have to stop this drug. But atrial fibrillation and atrial flutters are the indication for the, don't get confused. So it will slow down the conduction to the AV node. Okay, from the SA node to AV node, the speed of conduction will be reduced and thereby causing the less contraction or the rhythmic effect on the atrias, not on the ventricles. So the ventricular tachycardia and ventricular fibrillations are the contraindications, whereas atrial flutter and the atrial fibrillations are the indication for this digoxin. So these are the very important aspects you must remember about this digoxin drug. So that's all for the today's session. So hope you all enjoyed this session, and if you like this video, please press the like button and share it to your dear ones and the friends and even the students, those who are preparing for the competitive exams. And don't forget to subscribe and press on the bell icon so that you will receive my next notification on the important videos. Keep watching. So that's all for today's session. Thank you.